regarding the obesity and insulin resistance is really important. How's the patient develop hypertension and how's the patient develop type 2 diabetes. As we mentioned before, hyperinsulinemia and high blood sugar, this will lead to hypertension and diabetes by activation of the sympathetic nervous system and increasing the arterial tone. This will lead to sodium reabsorption and retention. And this also will cause diabetes by this mechanism of overstimulation of pancreas beta cell function, reduction of insulin secretion. All this will give you hypertension and type 2 diabetes. So now, what I mentioned here, as you see, obesity and insulin resistance, there is another name or other medical terminology. They call it insulin resistance syndrome, they call it metabolic syndrome, and they call it dysmetabolic syndrome. All these syndromes, it's the same principle and same mechanism as I explained before. So what is metabolic syndrome? Metabolic syndrome is a syndrome in which the physiological response is inadequate for the amount of insulin secreted. So as we see here, insulin resistance, this will cause atherosclerosis, which is leading to cardiovascular disease, and it will lead also to visceral obesity, which is leading to type 2 diabetes. By looking to this insulin resistance syndrome, we will have something we call it clinical manifestation, and there is biochemical abnormalities. The clinical manifestation is central obesity, as we mentioned, glucose intolerance, atherosclerosis, hypertension, polycystic ovarian syndrome, and biochemical abnormalities which include carbohydrate insulin resistance, hyperinsulinemia, lipid, it will increase the total cholesterol and decrease HLDL, and small or dense LDL will be increasing. Fibrinolysis, this will increase by increasing PAI. So regarding patient risk factors for the metabolic syndrome, let's say how I can make a diagnosis. This patient is having metabolic syndrome, or the other guy had no metabolic syndrome. There is a criteria, specific criteria and specific risk factors. One, actually, abdominal obesity, men if weight circumference more than 40 inches, and women if it more than 35 inches. Cholesterol if it more than 150. HDL, men if it less than 40, and women if it less than 50, and blood pressure systolic if it more than 130, and in some studies they said 140, and diastolic if it more than if it more than 85. Fasting blood sugar if it more than 110. All these factors, they said, if you found 3 of these, that means this patient having metabolic syndrome. So it's the same principle. They call it NCEP criteria. More than 3 of the following, you can diagnose patient with metabolic syndrome. So what's the prevalence of metabolic syndrome in the United States? They did this study in 2002, and it was published in JAMA. And what they found in most of all, I will say 50% of the population elderly, more than 60, and 50% of that population, they found that the risk of metabolic syndrome is really high.